Hello friends, today we will discuss very important topic which is anxiety, why it is occur and what's its sign and symptoms and how can we prevent and manage it effectively. Before starting our topic, my dear all friends, request you to subscribe my YouTube channel name as RM World of Medical Education because I need your love and support. Let's start our topic. Today we will discuss overview, type of the anxiety disorders, risk factors for anxiety, treatment and therapies. Occasional anxiety is a normal part of a life. Many people worry about the things such as the health, money, or the family problems. But the anxiety disorders involve more than temporary worry or a fear. For the people with an anxiety disorders, the anxiety does not go away and can get worse over time. The symptoms can interfere with daily activities such as job performance, schoolwork, and relationships. There are several types of the anxiety disorders. First one, the generalized anxiety disorder, panic disorder, social anxiety disorder, phobia related disorders, agoraphobia, separation anxiety disorder, and the selective mutism. What is generalized anxiety disorder? The causes of generalized anxiety disorders are genetics, stress, or excessive consumption of caffeine. Patient with generalized disorder may present persistent feeling of anxiety or the dread which can interfere with daily life. It is not the same as occasional worrying about the things or experiencing the anxiety due to the stressful life events. People living with the generalized anxiety disorder experience the frequent anxiety for the months, if not years. The signs and symptoms of the generalized anxiety disorder: feeling restless, wound up or on edge, being easily fatigued, having difficulty concentrating, being irritable, having headaches, muscle ache, stomach ache, or unexplained pain, difficulty in controlling the feeling of worry, having sleep problems such as the difficulty falling or staying asleep, panic disorder. People with panic disorder have a frequent and unexpected panic attacks. Panic attacks are the sudden period of intense fear, discomfort, or sense of losing control even when there is no clear danger or a trigger. Not everyone who experiences a panic attack will develop the panic disorder. During panic attack, a person may experience pounding or racing heart, sweating, trembling or tingling, chest pain, feeling of being out of control. People with panic disorder often worry about when the next attack will happen and actively try to prevent future attacks by avoiding the places, situations, or the behaviors they associate with the panic attacks. Panic attacks can occur as frequently as several times a day or as rarely as a few times a year. Now let's talk about the social anxiety disorder. Social anxiety disorder is an intense, persistent fear of being watched and judged by others. For people with social anxiety disorder, the fear of a social situations may feel so intense that it seems beyond their control. For some people, this fear may get in the way of going to work, attending school, or doing everything. Social anxiety disorder, which is previously called the social phobia, in this, the people with the social anxiety disorder have a general intense fear of or anxiety towards the social or performance situations. They worry that actions or behaviors associated with their anxiety will be negatively evaluated by others, leading them to feel embraced. This worry often causes the people with the social anxiety to avoid social situations. Social anxiety disorder can manifest in a range of situations, such as within the workplace or the school environment. People with the social anxiety disorder may experience the blushing, sweating, or trembling, pounding or the racing heart, stomach aches, rigidity, or speaking with an overly soft voice, difficulty making eye contact or being around the people they don't know, feeling of a self consciousness or fear that the people will judge them negatively. Now let's talk about the phobia related disorders. May have an irrational or the excessive worry about the encountering the feared object or the situation. Take active steps to avoid the feared object or situation. Experience immediate intense anxiety upon encountering the feared object or situation. Endure unavoidable objects and situations with intense anxiety. There are several types of the phobias and the phobia related disorders. Specific phobias, or sometimes known as the simple phobias, as the name suggests, people who have a specific phobia have an intense fear of or feel intense anxiety about specific types of the objects or situations. Some example of the specific phobias include the fear of flying, heights, specific animals such as spiders, dogs, or snakes, receiving injections, blood. Agoraphobia. It's a type of the phobia. So, people with the agoraphobia have an intense fear of two or more of the following situations: using public transportation, being in open spaces, being in enclosed spaces, standing in a line or being in a crowd, being outside of the home alone. People with agoraphobia often avoid these situations, in part because they think being able to leave might be difficult or impossible in the event they have panic like reactions or other embarrassing symptoms. It is the most severe form of the agoraphobia, and individual can become housebound. Separation anxiety disorder. Separation anxiety is often thought of as something that only the children deal with. However, Adults can also be diagnosed with the separation anxiety disorders. People who have a separation anxiety disorder have a fear about being parted from the people to whom they are attached. They often worry that some sort of the harm or something wrong will happen to their attachments figure while they are separated. This fear leads to them to avoid being separated from their attachments figure and avoid being alone. People with separation anxiety may have a nightmare about being separated from the attachment figures or experience the physical symptoms when separation occur or is anticipated. Selective mutism. A somewhat rare disorder associated with the anxiety is known as the selective mutism. Selective mutism occurs when the people fail to speak in specific social situations despite having a normal language skills. Selective mutism usually occurs before the age of 5 and is often associated with the extreme shyness, fear of a social embarrassments, compulsive traits, withdrawal, clinging behavior. What are the risk factors for the anxiety? The risk factor for each type of anxiety disorder vary. However, some general risk factors include the shyness or feeling distressed or nervous in a new situation in childhood, exposure to the stressful and negative life or environmental events, a history of anxiety or other mental disorders in biological relatives. Anxiety symptoms can be produced or aggravated by some physical health conditions such as the thyroid problem or the heart arrhythmia, caffeine or other substances medication use. If you think you or your loved one may have an anxiety disorder, getting a physical examination from the healthcare provider may help them diagnose symptoms and find the right treatment. Let's talk about the treatment and the therapies. Anxiety disorders are generally treated with psychotherapy, medications, or both. There are many ways to treat the anxiety, and a person work with a healthcare provider to choose the best treatment for them. What psychotherapy? Psychotherapy or the talk therapy can help the people with anxiety disorder. To be effective, psychotherapy must be directed at their specific anxieties and tailored to their needs. What's the cognitive behavior therapy? The cognitive behavior therapy is an example of one type of psychotherapy that can help the people with anxiety disorders. It teaches the people different ways of thinking, behaving, and reacting to the situations to help them feel less anxious and fearful. Cognitive behavior therapy has been well studied and is gold standard for the psychotherapy. Exposure therapy is sometimes used along with relaxation exercises. Acceptance and the commitment therapy. Another treatment option for the some anxiety disorders is the acceptance and the commitment therapy. Acceptance and the commitment therapy takes a different approach than the CBT to the negative thoughts. It used strategies such as the mindfulness and the goal settings to reduce the discomfort and anxiety. Compared to the CBT, the acceptance and the commitment Therapy is a newer form of the psychotherapy treatment, so less data are available on its effectiveness. What are the medications used for the anxiety? Medication doesn't cure the anxiety disorders but can help to relieve the symptoms. Healthcare providers, such as the psychiatrist or the primary care providers, can prescribe the medications for anxiety. Some states also allow the psychologist who have received the specialized training to prescribe the psychiatric medications. The most common classes of medication used to combat the anxiety disorders are the antidepressants, use of anti-anxiety medications such as the benzodiazepines and the beta blockers. Antidepressants. Antidepressants are used to treat the depression, but they can also be helpful for treating anxiety disorders. They may help improve the way your brain uses certain chemicals that control the mood or stress. You may need to try several different antidepressant medicines before finding the one that improves the symptoms and has manageable side effects. Antidepressant can take us several weeks to start working, so it's important to give the medication a chance before reaching a conclusion about its effectiveness. If antidepressants start taking, don't stop taking them without the help of the healthcare provider because abruptly stopping can cause the withdrawal symptoms, which can be very severe. Anti anxiety medications can help to reduce the symptoms of the anxiety, panic attacks, or the extreme fear and worry. The most common anti anxiety medications are called the benzodiazepine. Although benzodiazepines are sometimes used as a first line treatment for generalized anxiety disorder, they have both benefits and the drawbacks. Benzodiazepines are effective in relieving the anxiety and take effect more quickly than antidepressants medication. To avoid these problems, healthcare providers usually prescribe the benzodiazepines for the short period of a time. Beta blockers, although the beta blockers are most often used to treat the high blood pressure, they can help relieve the physical symptoms of anxiety such as the rapid heartbeat, shaking, trembling, and the blushing. These medications can help the people keep physical symptoms under the control when they taken for a short periods. They can also be used as needed to reduce the acute anxiety, including to prevent some predictable forms of the performance anxieties. Sometimes of the drugs may work better for the specific type of the anxiety disorder, so the people should work closely with the healthcare provider to identify which medication is best for them. Certain substances such as the caffeine, some over-the-counter cold medications and the herbal supplements may aggravate the symptoms of anxiety disorder or interact with the prescribed medications. People should talk with the healthcare provider so they can learn which substances are safe and which to avoid. Support groups. Some people with the anxiety disorder might benefit from joining a self help or a support group and sharing their problems and achievements with others. Support groups are available both in a person and online. Stress management techniques. Stress management techniques such as exercise, mindfulness, medications, or the meditations also can reduce the anxiety symptoms and enhance the effect of psychotherapy. A person can learn more about how these techniques benefit their treatment by talking with a healthcare provider. Please subscribe my channel and thank you so much for watching my video. Have a nice day.